basically the rest of Southeast Asia. So, how worrying is this situation in the region in general, do you think? And what do governments in the region have to do more to tackle this crisis that might be taking place in those facilities? Thank you.
Thanks for the question.
Thanks for the question.
I don't have specific numbers on the impact in prisons or mental health institutions in countries in Southeast Asia, but it's something we've issued guidance on in both cases. It's a concern. We've said the same about long-term care facilities in Europe, dormitories for migrants in many countries in the Middle East, in South Africa, in Singapore, prisons all over the world. We've talked about cruise ships and other types of vessels. We've talked about any long-term care facilities. And the reason why we've spoken and we've been so concerned about these facilities for two reasons. One is that if a disease gets into a closed community, the disease can spread very quickly. In fact, one of the most successful programs for doing sentinel surveillance for influenza over the last 30 or 40 years was using boarding schools to check for the disease, because once influenza arrived in a boarding school, it spread like wildfire. So you could pick up a signal of the arrival of influenza in a country by these groupings of people who amplified the disease. They almost became like amplifiers. So anywhere where people come together, a respiratory illness will spread quickly. That's always a difficulty and a problem. If it's a young, healthy community that are infected, then obviously the impact on them may be less, but at the same time could be significant. When that disease gets into an institution or a facility in which there are many vulnerable people, be it people with underlying conditions, older populations, then the impact of the disease, not just the transmission, is great. And I've said this before at these press sessions. It doesn't matter if you're in prison, it doesn't matter what your crime is. All citizens and all people in society deserve to be protected under the law, and as such there are responsibilities for all those who manage facilities to, number one, try and shield those facilities from disease getting in, having the necessary measures in place to reduce the chance that disease will spread, and that means having the capacity to detect very quickly. And I think one of the things in an institution that needs to be done really, really quickly is the first signal, the very first signal that something is wrong. You need to react very quickly. You need to be able to remove any individual that's suspected of being a case very quickly from that grouping, and you need to test, because a spark in a situation like that turns into a fire very, very quickly. Now, implementing those types of measures, hygiene measures, surveillance measures, and physical distancing measures, is a very constrained. It's a very constrained issue because prisons have a limited size. Some countries have dealt with that by releasing prisoners for non-violent crimes or prisoners towards the end of their sentences. That can be done. Authorities in Singapore are working very hard to improve hygiene and physical distancing in the migrant dormitories there. It's much more complex in certain other situations. People very often in mental health institutions have significant other needs, and they need to have that care and support. So you can't just leave people without that support. I think not only are there significant mental health implications of the pandemic itself on individuals, but there are people who have significant mental health problems who need constant support, and it's a very complex issue. How do you reduce the chances of infection in these facilities while still being able to deliver adequate care? But it also speaks, I think, in the long run to the whole concept of large-scale institutionalization of people with mental health difficulties. I think we need to find more sustainable solutions for dealing with those in our society who suffer mental health illness, and large mental health institutions in which people are sometimes abandoned is not necessarily, not only from an epidemic point of view, not a good societal solution for dealing with those in our society who are unfortunate enough to deal with long-term mental health issues.
Thank you very much, Dr. Ryan. Next question is from Swiss News, Laurent Sierra. Laurent, please, if you hear us, go ahead. Laurent,
can you hear me?
Yes.
Yeah. Thanks for taking my question. Question to Dr. Tedros. You briefed again the missions yesterday. I was wondering whether the countries whose leaders have been vocal in criticizing WHO, like the US and Brazil, are still actively taking part to these briefings, or do you face boycotts, and what kind of engagement are you able to maintain with these countries?
Yeah, thank you. Thank you for that question. We are actually in constant contact, and we work together. Thank you.
Thank you very much. Let's try to go to Morocco now, and it's a Morocco World News, and we have a Kristen Janaris. Kristen, can you hear us?
Yes, I can. Mm-hmm.
Yes, we can hear you too. Please go ahead.
Great. Thank you so much for taking my question. My question is regarding the WHO and EIB support for, you had mentioned 10 African countries. I'm curious as to which countries will be supported by this partnership and what the selection criteria is for them.
Thank you very much. Do we have Mr. Hoyer online? Maybe Mr. Hoyer would like to start.
I'm in, but I must disappoint you because this communication has not gone to the respective governments yet, and therefore for the time being, I cannot respond to this. And together with the WHO, we will do that within the next couple of days.
Okay, thank you very much, Mr. Hoyer, for this. Let me just see who do we still have online. Let's take Jamie Keaton from Associated Press. Jamie, if you hear us, please unmute yourself.
We good?
Jamie,
yes. Can you hear me?
Yes, now it's okay.
Okay, great, thank you. Hi, thank you very much for taking my question. I have just a quick question for Dr. Tedros and then a follow-up to Dr. Hussin. Does WHO believe that the Wuhan Institute of Virology was the origin of this coronavirus? And what are you doing to try to find out if it was?
Thank you, Jamie.
And just a quick follow-up for Dr. Hussin, because there was a very interesting question from National Geographic earlier, and I just wanted to make sure that we followed up on that. President Trump, Dr. Hussin, you mentioned lucidité a posteriori, which could be translated as hindsight is 2020, I think. President Trump has been very severe with WHO, and yesterday called it a public relations agency for China. How much should the emergency committee also be taking some of the heat from President Trump for not having stepped up earlier? And can you tell us which of your members spoke out against declaring a fake on 22nd, 23rd of January? Thank you.
Thank you, Jamie. We said one question per journalist. Thank you.
I was a follow-up.
Professor Hussin, do you want to?
Well, again, I must say that I am not entitled to disclose the discussions which occurred during the emergency committee because there is a confidentiality agreement which was signed. So I shall not say what was the position of each of the members. During the press conference on the 22nd, and 23rd, I said that the committee was divided, 50-50, and that there was a need to find a consensus to provide an advice to the DG. And at that time, the consensus was that it was a bit too early to declare a fake because there were 4 cases abroad and that it could be re-examined, of course, following a few days. Nevertheless, as said Dr. Tedros, recommendations were made which were allowing to start all the measures that would be necessary to implement in such a situation. So this is the only thing I can say on this matter. For the political aspect, I think Dr. Tedros is perhaps better placed than me to respond. Thank you.
Thank you very much. Yep.
And I can take, welcome Jamie. Press conferences aren't the same without you, so thank you for your question. With regard to the origins of the virus in Wuhan, we have listened again and again to numerous scientists who've looked at the sequences, looked at this virus, and we are assured that this virus is natural in origin. And what is important is that we establish what that natural host for this virus is. And the primary purpose of doing that is to ensure that we understand the virus more, we understand the animal-human interface, and we understand how the animal-human species barrier was breached. And the purpose of understanding that is that we can put in place the necessary prevention and public health measures to prevent that happening again anywhere. And that's that is what we are pursuing that and working and offering support to authorities to carry out such studies that will allow us to determine those very important outcomes, which will help us determine what the right steps are to ensure that this does not happen again.
Thank you very much. Next question is Xinhua News Agency, Mr. Wang, if I'm not wrong. We will try to get connection to Xinhua. Yes, please.
Okay. Thank you for taking my question. The question is for Dr. Tedros. In Wuhan, the central China city once hardest hit by the epidemic, the number of COVID-19 patients in serious conditions has dropped to 0 on last Friday. So what is WHO's comment on the response efforts in Wuhan? Thank you.
I can start. I mean, that's very, very welcome news to hear that there are no more severe cases, no more patients in Wuhan. China has worked very hard to bring the outbreak under control. I was there for 2 weeks and working directly with ministry officials and officials from all different sectors, from hospitals, through communities, to really see what was put in place to bring those numbers down. And we have learned, the world has learned from China, as it has from all countries that are dealing with COVID-19. And it is welcomed news to hear that there are no severe cases in Wuhan. That city really has had the hardest hit early on. There are a number of cities that are dealing with this now, and we need to continue to learn from Wuhan and how they are lifting those measures, how they are bringing society back to normal, or a new normal in terms of how we are going to live with this virus going forward. But we welcome all actions by all countries that are putting in place measures to suppress transmission, to identify patients early so that those early patients don't progress to severe disease. We welcome the innovation and the treatments that are in clinical trials right now that are looking so hard to find treatments to prevent people from dying from COVID-19. We welcome all, and we thank the healthcare workers who have put themselves on the front lines to care for patients, to be away from their own families to care for patients, to prevent those individuals who are infected with COVID-19 from dying. So nothing but admiration and thanks for the tireless efforts of the people of Wuhan, not just the healthcare workers, but the individuals who stayed in their homes, who adhered to the public health measures for extended periods of time. We take our hats off to you, and we thank you for your commitment and your service, and for sharing with us and the world what you've been able to do. So congratulations to Wuhan on this achievement. And we know that you will remain vigilant to find any additional cases that come, because this is far from over. And we know that, and everyone stands at alert to find cases as quickly as possible.
Thank you very much. We have time for one or two more questions, so we will try to go to Spain now. Cristina Masdiaria. Cristina, can you hear us? Hello, we are trying to get Cristina from Spain. Yes.
Yes. Yes, hello, can you hear me?
Yes, we can.
Thank you for answering my question. I would like to ask Dr. Maria Van Kerkhove if she could to understand where are we now in the evolution of the pandemic. If you can help us to have a portrait of the current situation in a world level. Thank you very much.
So thank you for the question. That's a difficult question in terms of where we are in this evolution. So we are clearly many countries are in the difficult time right now in terms of dealing with this outbreak. Countries across Asia have had their first wave of infection, and many have been able to suppress the virus, have been able to bring the virus under control. We are seeing some countries which have seen a resurgence, namely in outbreaks and clusters of cases, either in expat dormitories or in major cities. And so we're learning from Asia. In Europe, we're seeing a stabilization in many countries. We're seeing a decline in others. And so that is welcomed news, but many countries have imposed very strict public health and social measures, or so-called lockdown measures, and are looking to ease those. So we cautiously need to see how, with the lifting of those measures, how that will impact the virus in terms of its ability to transmit further. We are seeing increases in a number of countries across the Americas, and we've covered a couple of those today already. But there are many countries which are seeing an increase, which is a worrying trend. We're seeing a number of countries in the Eastern Mediterranean region see a stabilization and a decline in their cases. And again, this is welcome news in terms of their ability to suppress this virus. But again, they have also imposed strict public health and social measures. So we need to watch with caution as those increase. And the situation in Africa, there are a number of countries that are still seeing low numbers of cases. And there are opportunities in Africa, in many countries across Africa, to be able to prevent the ability of this virus to take off. Again, it's a complex picture across the globe of where we are. I think it is very clear that we have a long way to go. The early seroepidemiologic investigations that are being conducted are indicating to us that a large proportion of the population remains susceptible, which means that the virus has the opportunity to infect more people. So it's important that that all countries remain vigilant and keep in place their workforce to detect the virus, to detect people who have the virus and care for them appropriately, to isolate them, to find and trace all contacts and quarantine those contacts, to ensure that the public is fully informed of the situation in each country and at the lowest administrative level, because it's important that the public go with us in this and really understand that we have a long way to go. And so we do see encouraging trends, and I think we need to celebrate those successes, but we need to remain humble. And we need to remain vigilant because this virus likes to find the cracks, and it will exploit those cracks and find every opportunity to take off if it can. So we must do everything that we can to prevent that from happening.
Can I just supplement? Marie's given an excellent overview. I just want to highlight one particular situation that we've become increasingly concerned with, and that is the rising number of cases in countries affected by fragility, conflict, and with high numbers of vulnerable populations, refugees or displaced populations. Over the last week, a number of weeks, we've seen worrying increases of disease in Haiti, in Somalia, in Sudan, in South Sudan, in Yemen, in Syria, in Afghanistan, in Sierra Leone, in the Central African Republic, and most recently investigating a serious cluster of respiratory disease in adults in Kano in northern Nigeria. We remain deeply concerned about the impact that this disease will have in communities who are already greatly underserved, have many underlying conditions, and it's a real concern for the humanitarian community. And I know Mark Lowcock, the Under-Secretary General for Humanitarian Affairs and the Director General, launched a humanitarian appeal a number of weeks ago now. But there's still a lot of work to do in countries. We need to get sustainable access to all populations in all countries, and we need to be able to deliver essential health services as well as COVID response. I think it's truly important that this happens, because these populations have already suffered too much. And the extra impact of COVID-19 at this point can be avoided if we rush to provide the extra support that's needed for these people who live on all sides of conflict. And as the Secretary General has called for on a number of occasions, we need a de-escalation of conflict in these situations in order for a proper COVID-19 response to be mounted. No one on this planet will be safe until everyone is safe, and we cannot let this disease spread unchecked in these communities. It is neither the right thing to do, nor is it the smart thing to do.
And maybe we take last question before we finish here. Catherine Fiancan from France 24. Catherine?
Yes, do you hear me? Hello? Do you hear me?
Yes.
Okay, good afternoon. Thank you for taking my question. I would like to come back on the lifting of the lockdowns, because as you know, on May 11, the countries that have been the most hit by the coronavirus in Europe and in the United States are allowing kids to go back to school and some people to open the restaurants back. So I would like to see with you, to remain us what you know about the children, because in order to for parents not to be nervous, people say that children cannot be affected, that they cannot transmit the COVID. So could you please tell us what is exactly the knowledge, what you know about the virus for the moment, and also how long does the virus stay alive on a surface? Do you have an idea? Do you have a precise idea for the moment? Thank you so much to you.
So thank you for the question. This is an important question. As you know, we are learning more about this virus every day, and we are all concerned about the impact of this virus on children. What we know from data from all countries that we are receiving data from is that children appear to be less affected, and developing disease. And that means when you look at the number of cases that are reported from all countries, a very small proportion of those are children, ranging between 1% and upwards of 5% are among children up to the age of 18, in some countries 19. So it's a small proportion of the total number of cases detected. Among those children who are identified as having COVID-19, the vast majority of them develop mild disease and recover. And that is very important. We are trying to understand why that is, and there are studies that are underway to better help us understand that. There are some children, some who have had underlying conditions, others who have not, who have developed severe disease, who have had critical disease, and some children have died. So we cannot say universally that it's a mild disease in children. but the vast majority of children who have been identified as having COVID-19 have mild disease. You heard of a report the other day of an inflammatory disease in some children that was identified in the UK. Now that is significant in the sense that we have astute clinicians and nurses and healthcare professionals who are looking at how this infection is impacting the body, and they picked up a signal. This may be a real signal having to do with COVID-19, or it actually may not have to do with COVID-19 at all. What we've done within our clinical network, which is our global clinical network, is raise the alert and say, please look out for this. And we thank our colleagues in the UK for raising this so that we can better understand if this is something that is actually related to COVID-19. So just to summarize on the disease, the overwhelming majority of children who are detected have mild disease, and that's important. With regards to transmission, children are susceptible to infection, which means that they can get infected. And from the studies that have been conducted, which are well-designed studies in households, for example, they've looked at if adults are transmitting to children or if children are transmitting to adults. And in most of those studies, it's adults transmitting to children. But there have been some instances where they're suspected that the children infected the adults. So it can go both ways. Again, we need more information to better understand this, but children do remain susceptible, and they can get infected with this virus, but they do tend to have mild disease.
Thank you very much. We will conclude today's press briefing. I will just ask Professor Houssin and Mr. Hoyer if they would like to add something at the end. Maybe we start with Professor Houssin.
Very much. I have nothing to add. I think everything was said. Thank you.
Thank you very much for your participation, Professor Houssin. Mr. Hoyer, would you like to have some final word?
That we are going to start.
We didn't hear you. Can you just repeat, please? You were on mute. Sorry, can you just please try one more time because we couldn't hear. Unmute yourself, please.
Something seems to be wrong with the unmuting here.
Now it's okay.
Better now?
Now it's okay.
Okay, so just thank you very much for the opportunity, and let's start a great cooperation.
Thank you.
Good luck for your work.
Thank you very much for your participation.
Thank you, Professor Houssin, and also my friend Warner. And I would like to thank all who have joined, and I would like to wish everybody happy Labor Day. Have a nice weekend. This too will pass, and the antidote is solidarity. Let's stay together. Thank you so much. And see you on Monday.
And we will have an audio file available very shortly and transcript hopefully tomorrow. Have a nice weekend and happy Labor Day.